Last month, a patient sat across from me and said something I hear far too often. I am doing everything right, so why is my COPD still getting worse? He was 64, ex smoker, on 3 inhalers, perfect adherence for 2 years. And I had to tell him something difficult. It wasn't his fault. But the advice he was given was incomplete because most people with COPD are only getting half the picture. And that missing half, it's what decides whether your lungs decline slowly over decades or much faster than they should. COPD can be slowed down significantly, but only if you take the right steps, starting now. I am Dr. Suman Paul, a respiratory physician in the UK. I have spent the last 15 years treating COPD patients, and what I'm about to share is exactly what I tell my own patients. COPD is called a progressive disease, meaning it worsens over time. But what most people aren't told is this: the speed of that progression is largely in your control. And in my experience, the difference between a slow decline and rapid deterioration often comes down to 7 specific decisions. Before we go further, this is a general medical education and not personal advice. And if you ever have severe breathlessness, chest pain, or blue lips, seek emergency care immediately. Now, let's get into it. First, every case of COPD has a driver, a villain, and many patients think they already know what it is. Often, they are wrong. Yes, smoking is the most common cause, but around 15% of cases in the UK are linked to workplace exposure, dust, fume, chemical, farming, construction. So if you have spent years in those environments, your job may be the real culprit, not just cigarettes. Think of your lungs like a leaking bucket. You can add the best inhalers, the best treatment, but if the hole is still there, you are fighting a losing battle. And if you are still smoking, stopping today is the single most powerful step you can take. Even in advanced stages, the rate of decline slows, often within months. Step 2: your inhaler strategy. COPD is essentially narrowed airways. Long-acting bronchodilators help open them. Using two types together, a dual bronchodilator can work in different ways to keep the airways open longer. For some patients, this improves symptoms and reduces flare-up compared to a single inhaler. And fewer flare-ups means fewer hospital visits and less long-term lung damage. So if you are only using a reliever inhaler like salbutamol or Ventolin, ask your doctor one simple question: is my current inhaler giving me the best control for my COPD? That one question can change your day-to-day breathing. Now step 3 is something very different. It's free. It's available on the NHS and most patients are never even offered it. Pulmonary Rehabilitation. This is an 8 to 12 week program combining supervised exercise and education for lung disease. And the evidence is strong. It reduces hospital admissions, it reduces breathlessness, and it lowers the risk of death from COPD exacerbations. All from a free program. So here is exactly what to say to your doctor: I would like a referral to Pulmonary Rehabilitation. It's nice recommended, you are entitled to it. Step 4. This one surprises people. Your leg strength, especially your quadriceps muscle on your thigh, is one of the strongest predictor of outcomes in COPD patients. Sometimes even more informative than the lung function itself. Why? Because COPD affects the whole body. It leads to muscle wasting. You become breathless, so you move less. You move less, so you get weaker. You get weaker, so you become more breathless. It's a cycle, so you can break it. Simple exercises: seated leg raises, chair squats, resistance bands. 5 minutes, 3 times a day. No gym required, just consistency. Step 5. Something simple, inexpensive, and surprisingly effective. A handheld fan, which often costs less than £20. Direct cool air towards your face, especially around your nose and the upper lip. The cold airflow activates nerve receptors in the facial skin that sends direct signal to the brain, telling it to reduce the sensation of breathlessness. It doesn't improve the lung function, but it reduces the distress of breathlessness, often within seconds. During a breathless episode, try the fan along with your inhalers. Slow breath in through the nose, fan directed at the face. Many of my patients describe this as a turning point, not because it fixes the lungs, but because it gives them back a sense of control in a moment that usually feels completely uncontrollable. If you are enjoying the video till now, then you might benefit from joining my lung health community, where I regularly share many helpful information for COPD and asthma patients. It's completely free to join. You will find the link below in the description. Step 6. Hidden conditions. COPD rarely exists alone. Many patients also have heart failure, atrial fibrillation, anxiety, depression, sleep apnea, or even type 2 diabetes. And here is the problem. All of these conditions can also cause breathlessness. So patients assume their lungs are worsening, when the real issue might be their heart, their sleep, or their mental health. I see this often. Lung function stable, but symptoms worse. So if things are declining despite treatment, ask, have we properly assessed your heart? Consider a heart scan. Ask about a sleep study. Don't assume your lungs are always to be blamed. 6 down, 1 remaining. And the last step is the one patients most consistently underestimate, because it doesn't feel like active management, but the data behind it is as strong as anything else on this list. Step 7 is vaccinations. Most COPD flare-ups are triggered by infection, flu, COVID, pneumonia, RSV. Each flare-up causes damage that doesn't fully heal. Think of it like a fire in your airways. The fire goes out, but the damage remains. So prevention is critical. Stay up to date with annual flu vaccine, pneumococcal vaccine, COVID vaccine, depending on the current rules and regulations, and RSV vaccine, which is newly available in the UK for patients aged 75 and over. This is one of the simplest and the most effective ways to protect your lungs. So let's bring it all together. Identify and remove your trigger. Optimize your inhaler treatment. Ask for pulmonary rehabilitation. Build the muscle strength daily. Use a handheld fan for breathlessness. Check for other hidden conditions and stay up to date with vaccines. COPD is serious, but it is not a death sentence. The patients who do best aren't always the ones with the mildest disease. They are the ones who take the right steps early and consistently. And the important thing is this: every single step we have discussed can be started this week. No hospital admission, no expensive treatment, just informed action. If this helped you, share this video with someone who needs it. And please subscribe to this channel. And if you want to learn about using your inhalers correctly, I would suggest watching the next video, because that's one of the most common reasons for COPD symptoms not getting better. See you in the next video.